Good morning. Greetings to you from Bangalore Baptist Hospital. We are here today to discuss with you regarding what everybody is talking about, the COVID-19 situation. I'm Dr. Kingsley. I'm the Deputy Chief of Medical Service here, and it's a pleasure for me to be here hosting with this session for you. And with me is Dr. Girish.
Hello, viewers.
And he's a consultant physician and also Deputy Chief of Medical Service, and also Dr. Indu Nair.
Good morning.
She's an infectious disease specialist, and we are here to shed more light on the present situation, how we can, as a community, cope with this so that we can handle things better. So, over to you, Dr. Indu.
Good morning, all. So, before we start the session, just a brief introduction as to how this started and what this is all about. The COVID-19 is caused by a virus, as we all know now. It is a beta coronavirus, and the first incident was reported to the WHO on the 31st of December. In February, the end of Jan rather, the WHO declared this as a public health emergency of international concern, and on March 11th, WHO declared this as a pandemic because by March 11th, this disease had spread to more than 114 countries involving almost lakhs of people by then already. Now, a few things about the virus is we have coronaviruses actually are not new to us. They have been there for the past many years. We've had pandemics before, but not to this level. The first pandemic was in 2003, where we had the SARS, which again originated in China, in the Guangdong province. And in 2012, we had the MERS virus, which was again another coronavirus, which was in Saudi Arabia. Now, the present coronavirus has been labeled as a novel coronavirus because novel means it is genetically distinct from the others that we know. So, the distinction is the reason why we were not able to actually initially know what this virus was. So, this is the basic thing about the virus. So, over to Dr. Girish, who will now tell you.
Yeah, thank you, Dr. Indu, for that introduction. And as we all know that, how the coronavirus came and then how did it spread and became a pandemic over the last 6 months. Now, I speak about few numbers, but these numbers are changing as we speak. So, it's a pandemic, that means already it is spread across the continents and more than 180 countries are affected now. And if you talk about the numbers as such, worldwide we have about 85 lakhs plus cases with the fatalities of around 4.5 lakh cases. So what we are worried about is not the number of cases, it's number of deaths or fatalities that is related to this disease. And coming back to India, we have about close to 4 lakh cases as of now, as of today, and deaths hovering around 12,000, which translates into like a fatality of about over 3%, less than 3.5%. And speaking about Karnataka and Bangalore, Karnataka has more than 8,000 cases, and again a death rate of about say 1.5%. When we talk about the death rate, it keeps ranging from anywhere between 1 to 3.5% in our country. We are always worried about the death rate, not the number of infections. As we talk down the line, we will know it's very important. It's not just the infection alone, it's the mortality or the deaths that is related to this disease. Now, as I said, numbers. Now, what have we done so far? We have ramped up the number of testing facilities. We have enough of time to prepare ourselves in terms of putting up the infrastructure, about knowing more about the disease, testing and treating. So now as I talk, we have about a capacity to do more than 10,000 tests per day in Karnataka. So cumulatively we have done almost over 4.5 lakhs of testing, out of which about 8,000 are positive. So that is the current status as it stands now. Over to you, Dr. Kingsley. Yeah.
So just to say that we just are hearing more and more of COVID, and it's like watching the news, we see 80% of the news is on COVID. So that's how it has become. And we are here at Baptist Hospital trying to shed more light on the situation now. And Dr. Girish, our Deputy Chief of Medical Service, has just now given an introduction of how the situation in the world, India, particularly about Karnataka and Bangalore. And preceding that, we had Dr. Indu talking about an introduction to corona, where it came, how long it has been around, and what are the situations in it. She's our infectious disease specialist. And I'm Dr. Kingsley. I'm the Deputy Chief of Medical Service, and it's a privilege for me to host this situation on COVID and help you to handle this better. So what about COVID? How does it present? When you look at the clinical presentation of COVID, it ranges from having no symptom at all, or what we call as asymptomatic status, to somebody who's extremely sick and requiring ICU care. So 80% of the people are likely to not have much symptoms for them to come to the hospital. Around 20% may have some fever, body pain, and a kind of flu-like symptoms, and they may have to come to the hospital. And in that, around 5% may actually be sick enough to require hospitalization. That is, they may require oxygen and supportive care. And India has been thankful to say the deaths related to COVID are very, very less compared to Europe and US. So when it comes to the symptoms, major symptom that we are concerned is fever. Almost 80 to 90% of the population who have COVID infection can have fever. The next would be a dry cough, and following that would be body pain and vague symptoms of having a sore throat and additionally diarrhea. We have newer symptoms like new onset loss of smell also as one of the symptoms. As a person gets more sicker, they can develop shortness of breath and associated problems. And these patients who are manifesting symptoms, their age group matters. And if they are older, they tend to be more sicker. And if they have associated conditions, like if they are diabetic, have a heart disease or an underlying kidney problem, or their immunity is reduced because of additional problems like cancer and things like that, they all may have a worse presentation. So that's how the whole the children on that aspect actually present much different. And so far, the children who have suffered from the disease numbers are really low, and we are really thankful for that. And this spreads, and Dr. Indu will talk more about the spread of it.
Yeah, so as we all know, I think everyone is now aware that droplet transmission is the major mode of transmission. So for any disease per se, for any infectious disease to spread from one person to another, there has to be a reservoir and there has to be a portal of exit. So if we can take care of the portal of exit and the portal of entry, so in this case the portal of exit is your mouth. As you sneeze, as you cough, as any person coughs, we generate droplets in various sizes. So the larger droplets, which are more than say 5 micrometers, etc., they tend to just fall within 1 or maximum of 2 meters distance, and then they settle down on the surfaces around you. Those droplets which are less than 5 micrometers tend to hang around in the air, and as per the wind speed, as per the dynamics of the wind in that room or the area which you are in, it is likely to remain suspended in the air for a longer time. There is no definite evidence that COVID is airborne as of now. There could be, under special circumstances, when there is a large amount of droplet which has secreted by some procedures in a closed room within a certain period of time. But otherwise, as we know, it is mainly droplet, that is larger droplets, which travels to maybe 1 up to 1 definitely, and maybe a little more up to 2 meters. The second is these droplets which settle down on the surfaces of objects around you and are called fomites. A person accidentally touches the surface and then touches his mouth, his nose, his eyes, and that's how you transmit it to yourself. So this is your portal of entry as well as your exit. So taking care of these two portals is very, very important. Two other things. Number one is the something called the R naught, that is the one person who's infected, how many person does that person further likely to transmit the disease to. As of now we know that it is 2.3, so one infected person is likely to infect another 2.3 people ahead. The second thing is, as I talked about the portal of entry and the exit, so there has been studies which have shown that if the person who's infected wears a mask, then there is only a moderate risk to the other person receiving it if he's not wearing a mask. But if both are wearing a mask, it's a very, very low level of transmission which has been recorded. So transmission by itself, Dr. Kingsley, is mainly about droplets and fomites. Okay. Over to you, Dr. Girish, to talk about the vulnerable population.
Yeah, thank you, Dr. Indu and Dr. Kingsley. Both of them have clearly said what are the symptoms that would be associated with this disease and then how it gets transmitted. Now, as I said earlier, that what we are worried about is not just the rate of infection or the incidence of infection, but it is the fatalities or deaths related to the disease. Now, if you look at it, as I said, it could vary somewhere between as low as 1% to 8% in some European countries, right? So how could we prevent, and who are these populations who are vulnerable to have a severe form of the disease? As Dr. Kingsley said earlier, about 5% of them become critical. That means they require an ICU admission or a ventilation, other support systems. And these are the people who are likely to have a severe forms and then die out of the disease. So if you look at it, age is one of the most important factor. There is a clear studies and evidences from the European studies to say that, as the age advances, the risk of having a severe form of the disease is high. So like it says, at the age of 20 to 29, the people who are going into a critical stage are less than 1%. The same thing, when the person attains the age of 80, the risk is almost close to 20%, 18%. So that is where we have to be high. The highest risk is amongst the people who are after 65. So the whole idea is about securing them so that they don't get contracted with the infection. Then coming down after the age, it's about the pre-existing medical illnesses. One of them is a cardiovascular diseases such as previous heart attacks, what we call ischemic heart diseases, a valvular heart disease, and then the lung conditions such as COPD or chronic obstructive lung disease, cancers, smokers, and people who are suffering with cancer, particularly the blood-related cancers like what we call blood cancers, and chronic kidney diseases, people who are on dialysis, people who are taking some immunosuppressants, or the people who are most vulnerable for this. So the whole idea purpose in terms of prevention is to identify these group of people and segregate or secure them or put the preventive measures at the strictest possible way to this population. There are several questions which, in my routine practice, I had seen people asking me, I'm an hypertensive patient, I'm taking these drugs, should I stop it? Yes, initially there were reports in the media, maybe even amongst the journals, saying that some of the class of drugs like AC inhibitors, enalapril had to be stopped. But there is no evidence later on. In fact, people say that there could be a possible benefit, so there is no need to stop these medicines when you are on hypertension. And again, same people like people who are asthmatics, they say I'm on inhaler which contains steroids. Can I consume? Please, if your clinician has prescribed you to take it regularly, continue. So our whole idea is to identify this high-risk population and put a preventive measure for the strictest possible.
Yeah, thank you, Dr.
Yeah,
and how do we prevent or how do we handle the situation better? So we've been hearing a lot of lockdowns initially, and now we are on unlock 1 and 2, and we will have the unlocking happening. But what is it that we can do? So most important thing is physical distancing, and we've been talking a lot about how to do that and what is the most approximate distance to maintain. So simple things that we can do. When we meet people, greet without physical contact. The traditional way of greeting makes a lot of impact. We don't need to shake hands or hug. So greet without physical contact. Maintain a physical distance of at least 1 meter so that you don't get really close enough. Wear a face mask. Face mask or a reusable face cover, whichever that is appropriate. For most public, it would be to use a cloth mask, and you can always reuse them. And avoid touching the men, mouth, eyes and nose. Yes, so avoid touching them, because when we touch, we will end up putting them in an infective cycle. Maintain respiratory hygiene. This respiratory hygiene can be of different ways. Use a tissue, make sure you dispose correctly. If you don't have one, cough, sneeze into your elbow so that you don't have to get your hands contaminated. Wash your hands thoroughly. Okay, so this would be something very useful, and when we do it on a regular basis, it would be a way of disinfecting and keeping yourself clean. And in India, there's a habit of spitting, and this is a good time to stop it. Okay, it may be just your regular spit or chewing tobacco, whatever form it may be, I think we should stop it. And in any workplace, constantly touching areas, it's good that we clean them more often so that the contact becomes much less. Avoid unnecessary travel. If you don't have to do it, you can always do it later. You don't need to do unnecessary traveling. And when we are at this situation, people's behavior are very, very important. So what affects the people's behavior is their anxiety level, their concerns, and how they would. So to make life easier for everyone, do not discriminate people who have potentially been quarantined or who have had this disease. So that makes them to do all things in a different manner. Hide and do it, not get caught. So that kind of behavior. So avoid discrimination. And do not circulate social media messages which don't necessarily have to be circulated. There are a lot of fake messages which are going on, and I'm sure we could avoid spreading that. Use the right information about COVID-19. Take it from credible sources, because there are a lot of people who are claiming they have cures, they have different treatments which will work. Let's be careful about what we follow. And most importantly, if there is a crowd, avoid it. Okay, because wherever there is a gathering, there is a higher chance of infection, and that can be an epicenter. And this is a time where we all are under stress, not just general public, even the healthcare system, our frontline workers, as in the police, the government officials handling this, everybody is at a high stress situation. Let us be mindful of that so that we can work together and make a best use of it. These are all the preventive measures definitely would work. And once prevention is there, cure doesn't have to be bothered at all. But we still need to know how the disease is diagnosed. So Dr. Indu.
Thank you. So diagnosis as of now is only by molecular diagnostic methods mainly. It's called an RT-PCR. It's a reverse transcriptase polymerase chain reaction. So what actually I don't think we need to go into details, but what they do is they take the nucleic acid of this, they just transcript it, make it many times longer and try to read the sequence and make a diagnosis based on that. So RT-PCR is what now we are doing on a regular basis. The second thing which we could do is serology, which we've not started doing. Serology actually is like when your body is infected with any virus or bacteria, you have like an army of infantry comes in first, right? So you have an antibodies, a large number of antibodies which it comes in to kill this virus. So you could identify the initial infantry line antibodies, which are the IgM antibodies, and then there are later ones which carry some memory to them so that you can recognize it if you have this disease again in the future. So those are called the IgG antibodies. So serology mainly targets these two. It's identifying the IgM and the IgG antibody. So that actually only helps you to know whether this person has had the disease. So this is mainly used for surveillance and to know the not prevalence exactly, but to know how many people have had the disease and gone through it. The third thing that we normally use is a chest X-ray. Actually, an X-ray is a very simple and a very useful diagnostic tool in a clinical setting. So we do an X-ray, there are particular findings on an X-ray which sort of clinically points out that this could be a COVID. The CT scan is being used in many countries as a frontline investigation for people who are suspected COVID, but we are not using it as a frontline diagnostic investigation. There are several blood markers which get elevated during this period and could point you in the right direction as well. Now coming to the management of COVID. As we all know, there is no definite cure known for COVID. Okay, so it's mainly supportive. So as Kingsley mentioned initially, 80% of the people who get the disease and are infected with the disease actually have a mild form. You may have a mild respiratory with maybe a sore throat, fever, myalgia, headache, and that's it, you recover. They don't really need treatment. What they need is isolation and quarantine so they don't spread it to the next person. The second 15% are the people who have moderate to severe disease. In this, a larger part of the lung is involved. You will start having breathlessness. You may require a little bit of oxygen. So these people need hospitalization and monitoring because as Dr. Girish was mentioning, those who have comorbidities with this, those who are older may suddenly worsen. Only 5 to 8% of the people are actually critically ill. And those are the ones who require most of the times invasive, maybe mechanical ventilation, sometimes just a high flow oxygen, etc. Now, coming to medications, there is no definite medication which is made available for COVID. It's mainly supportive care, and a large number of people actually get cared just with supportive care. So we need to know the way forward, whether we have a vaccine, etc. Dr. Girish will lead us into that.
So now that you heard from both the speakers saying that it's more of a symptom management and there are no specific antiviral drug and we are all waiting, somewhere it is peaking, somewhere the curve is flattened, somewhere it is starting. So we are in all phases across the country. Now, what is the way forward? And we all know that you would have read in the media, everywhere else saying that vaccine is the only way out. Now, herd immunity that you would have heard. Now, when the vaccine is in the due course, sometime Oxford study says that it could be somewhere out in the month of November, December, early next year. We do not know about that. Yes, how effective is the vaccine also we need to know. But when the vaccine is still awaited, what is the way forward for us to deal this pandemic, at least in our country? So like it was often said by Dr. Kingsley saying that, the physical distancing, wearing of a face mask or a face cover, hand hygiene, avoiding congregations, avoiding close contacts, that's a way forward for me. And then the lockdown has obviously given us enough of time for the governments, for the hospitals, for the administrators, for doctors to prepare themselves, to ramp up the test, to understand the disease better and the way to deal the disease in a better way. What do you think we should go for way forward? Like when the vaccine is still due, no specific antivirals, but again, whatever the 15 preventive aspects that you mentioned is a very, very important thing. And, identifying those high-risk population is equally important. And one thing I just want to let you know is that Karnataka government has done an extremely exhaustive survey where 1.5 crore households have been surveyed. And they've identified who are all the risk people and they are in contact with that. And probably this is a massive exercise they have done, which is very unique in the country. So we know who are all the vulnerable, where do they live, how are they doing it. So those are the steps that has been carried out. And what do you think? the way forward?
I think one thing is we should take the responsibility on ourselves, not leave it to others. Don't wait for the government to do things, don't let the doctors to wait to do things. Take the responsibility on yourself.
Absolutely, yeah.
Yes.
Collectively, we have to combat this
Exactly.
pandemic. It's
Exactly.
not
That's the
one
only way we
policy
can go
by the
forward.
government that would determine
Absolutely.
the outcomes of it.
Absolutely.
It is we as a public has to pitch in and then follow the SOPs that is laid down.
So, COVID as a disease
And-
has come here, and
It's
we are now
likely to stay.
coping
Yeah.
how to learn to coexist.
True.
And it is a balance which we have to achieve where the disease numbers that are rising, we handle it in a sensible way. And when we say sensible, it's like, what can we change? We can't change the world, but we can change the way we function. And when we change the way we function, we actually contribute to the community,
Absolutely.
and as a whole, the whole nation and the world, how we can handle it.
Exactly.
And one more thing, what I see is the panic
Yeah.
amongst the people, stigma it is carrying.
Anxiety,
There's a
panic.
lot of anxiety that has put in. As I said, as you rightly said in the beginning, about 80 to 90% of them become better. It's only that 5% population.
That's
See,
true.
that 5% population could be there with any other disease too. Only thing is the infectivity rate is high. So we shouldn't be afraid of it and then, create an anxiety amongst the people and the public at large. As we know that COVID-19 is in existence for the last 7 to 8 months, and it has become a pandemic which has affected almost more than 180 countries in the world, and India is no exception to this. Currently we have about close to 4 lakh cases across the country, and talking about Karnataka, we have over 8,000 cases with the fatalities of about close to 120, 130 as I speak today. The numbers keep changing, and looks like it's going to be here. The only way forward is about the preventive measures, and we all have to actively involve ourselves into the, following the safety measures or preventive measures such as, wearing mask, hand hygiene, avoiding gathering, and so on.
So the COVID situation has become very prevalent now, and Karnataka is catching up with the others on the rest of India. So when we look at how do a person present with COVID symptoms, so typically they can have no symptom at all, as in asymptomatic, or they can be so sick that they require artificial support like ventilation and in the ICU. But when you look at the spectrum, 80% of the people do not have much symptoms at all, that they don't even come to the hospital. So the remaining 20%, they may require some hospital visits, and around 5 to 8% may actually get admitted into the hospital requiring oxygen. And in that also, around 3 to 5% is who are the ones who land up in the ICU. And people in India have been lucky enough that there has been hardly any deaths as compared to the rest of the world, like Europe and US. So that way our death rates are much lower. And who are more affected by COVID? Typically elderly, more than 60, 65, with comorbidities like diabetes, heart disease, underlying kidney disease. They are the people who are more affected by these disease. And at-risk population, when we say, is this elderly population, and also people whose immunity is compromised, as in cancer patients and patients who are on treatment to suppress their immunity and things like that. So they are the people who are more at risk of getting these disease. And we need to look at how we can protect them and how we can handle them. So that is where we need to see whether the elderly and the children, all of them, do they need to be separated to handle them in a manner which is appropriate.
So we all know, I think by now everyone knows that the modes of transmission of this disease is basically through droplets. So what do we mean by this? This is when you speak, when you talk, there are a lot of droplets of various sizes which comes out, which sometimes get suspended in the air, the smaller ones, the others settle down, the others get onto your face, your nose, your dress, your spectacles, etc., etc. So the mode of transmission is basically droplet transmission through these larger droplets and surface contamination when we touch a surface and then we touch our nose or our mouth or our eyes, and we can carry this virus from these surfaces to these areas that we get contaminated. So what is the most important message as of now that we're trying to portray is, prevent this transmission, break the chain of transmission somewhere, either at the exit by wearing a mask. All symptomatic, non-symptomatic, wear a mask. Symptomatic patients ideally wear either a surgical. If you're definitely positive, wear an N95 mask. For all others who are not infected but are likely to get infected, definitely a mask. So both your portal of exit and your portal of entry is sort of sealed. And the second thing is, so that we don't go around spreading it from your surfaces to your mouth or nose, wash your hands as frequently as possible. Sanitize, if not washing, at least hand sanitize with an alcohol-based rub. An alcohol of more than 60% is enough to kill the virus. Hand wash is the best. If you can wash your hands frequently, please do. And the third thing is, as we know, these are larger droplets and settle down within a meter, very rarely beyond a meter. Maintain a physical distancing of at least 1 meter. So I'm sure if we take these 3 major precautionary measures, we can to a great extent protect ourselves and our families.
That's nicely put in. So we have our preventive measures, which are the most important thing, and that's how we handle it. And remember, when we are following these preventive measures, we protect ourselves and our community and thereby the whole nation. And one of the important changes that we need to focus on is our mindset of how we are going to handle COVID-19. It is here, we need to handle it. So do not be afraid, do not panic, do not discriminate people who have COVID so that they resort to different kind of behavior. Discourage crowds and always take this as a point where we are going to encourage people to be safer. And let's not spread social media news which are fake or could add to people's anxiety. So these are things which we can follow.
I think together we have to combat the disease.
Let's be responsible and behave responsibly. Thank you.
Thank you.
Thank you.